So welcome to a presentation on how we might get better at managing stress and anxiety. We'll be exploring the relationship between stress, anxiety and worry. I'll be sharing with you a stress appraisal and coping model. We'll be looking at problem solving and how to get better at it. I'll be sharing with you 10 tips for managing anxiety and encouraging you to take action. And I'll be sharing with you some options for further reading in case you want to take any of the ideas in this presentation further. So how are stress, worry and anxiety related? Well, there's no single agreed definition of stress, but it's certainly something to do with being challenged, and different things can cause different people to feel stress. So it depends on the context and the individual, for instance. So arguments, but even exercise can cause stress, public speaking, losing a job, etc. So a wide range of things are known to cause stress, but perhaps not to everybody. And there's a range of different emotional and behavioural reactions to being stressed. So stress can be associated with a range of different emotions or none at all. It depends on the person and the situation. But it's not uncommon to experience some anxiety in response to certain forms of stress, and worry in a way can be considered a low level of anxiety, which is entirely normal and can indeed be quite helpful. So perhaps anxiety exists on a continuum, with clinical levels of anxiety at one end of the spectrum and normal levels of worry and anxiety at the other. And there's an association with thoughts and bodily reactions and feelings and behaviours. So these things make up anxiety. It's not just one thing. So if I'm working with an individual from a clinical perspective who has anxiety, I want to understand how severe and persistent the anxiety is. Does it appear to be excessive for the situation? Does it lead to avoidance and doing important things and impairment of day-to-day functioning? Perhaps people are off work or they're avoiding leaving the house. And clinical anxiety can take different forms. People can have a sociophobia, they might have panic attacks, or they can be just a generalised anxiety. And if prolonged, anxiety can lead to depression or heavy drinking. So if this is someone's level of anxiety, they will probably benefit from seeking help, seeking professional help. Now, normal levels of anxiety are kind of low levels, really, of fear and apprehension, which are entirely normal before an exam, before an interview, before a sporting or theatrical performance, or even before a difficult conversation. And here the anxiety and worry can help focus our attention and prepare and perform better. And typically this kind of healthy worry and anxiety is short term, and it goes away when the challenge goes. And I certainly wouldn't want to be without normal levels of anxiety and worry, because it can be functional and helpful, even though it can be a little bit uncomfortable. So let's look at stress in a bit more detail. Now, as I mentioned, sometimes just talking about stress may not be helpful. So when I talk about stress with people, I like to divide it into, as it were, stressors, the things out there which cause us to feel or be stressed, and the stress response, how our bodies and minds react to those stressors. And there can be a relationship here, because some of the ways we respond to stress can then become stressors. So for instance, if we drink heavily or we get very angry, that can then cause situations in our lives that can become another source of stress for us. And it's this relationship between stressors and how we respond to stress that might even have a positive impact on our health and well-being, or it could lead to our health and well-being the same. And as I mentioned, sometimes it can lead to worsening health and well-being and quality of life over time. So let's dive into this model in a bit more detail. So I still very much like this model from 1984, the stress appraisal and coping model, in which you have some stressors that we've talked about, and these can come from a range of different domains and settings, and sometimes it can be worthwhile thinking about precisely what is the source of the stress or the stressor you may be experiencing. And then there's our judgments about the stressor. Now, some of these judgments are very rapid and can occur outside our awareness, and this is called primary appraisal. This is the fast brain And we're asking ourselves, but perhaps not consciously, is there danger? Is there threat? Secondary appraisal is what might happen afterwards, which is to do with, can we cope? So there's this judgment or appraisal of a situation or event as to whether or not it's harmful, whether or not we can cope. And then how do we actually cope? Well, there are a couple of ways of classifying coping strategies. One important way is to think about emotion-focused coping strategies and problem-focused coping strategies. Problem-focused coping strategies attempt to deal with the problem or the stressor out there in the world, whereas emotion-focused coping strategies tend to deal with the emotions and feelings that can arise within us when we experience stress. And you can even classify your emotion-focused coping strategies as being healthy and good for you, perhaps unhealthy ways of dealing with powerful emotions and feelings. And sometimes the way we deal with powerful emotions and feelings is to avoid doing something which may be good for us. And then there's this interaction, as we've discussed, between the stressors, how we think about and appraise the stressors, and the way we cope. But there's another element that I'd like to share with you, and these are called buffers sometimes. So there are things we can possess more of or less of, which seem to act as a buffer from stressful events and situations and well-being. Good quality relationships, for instance, meaning and purpose in our lives, even our fitness levels and our philosophy and mindset. So there's a range of things that can help buffer us against adverse events and situations. So what can you do about unwanted stress? Well, there's only a few things really if we wanted to classify them. We could, for instance, try to reduce our exposure to stressful events, situations and relationships, perhaps working with other people to change the environment. Then there's reframing or perspective taking. How can you change the way you think about certain events and situations so they're less stressful? And indeed, how might you think differently about a situation, which may change it from being a source of threat to a source of challenge? Then there's improving your skills in coping with unwanted and even painful emotions and feelings. And then getting better at problem-focused coping and problem solving. And we'll be diving into that in just a minute. And then there's doing things to strengthen your buffers or these protective factors that I mentioned. And to help you gain a bit more control, we have a little worksheet for you, which you might find helpful to think about and name, in a way, some of your main sources of stress at the moment. And then give some thought to how much this particular source of stress is under your control. Because if it's not at all under your control, you may well be better just accepting it and focusing on things that are under your control. And then if you feel that this source of stress is under your control, think about 2 to 3 steps that you could take which may lead to improvement. And of course you could do this with someone if you think that may be helpful. Now, one thing that can be helpful when we experience stress is to problem solve and get better at problem solving. And people vary in how good they are at problem solving. So if we wanted to follow a process, it may be, first of all, that you write down, generate a list of problems and sources of stress. You might then choose one to work on. Think about what makes it a problem and how would you know if it was getting better or getting less. Then brainstorm all the possible steps to resolve or reduce this problem. Then evaluate the steps and ideas and choose the 1 or 2 you're going to trial in your life. Test out some of the changes or one of the changes you've thought about and see whether or not this change actually helped reduce the problem. And then if it hasn't reduced it enough, continue or choose another problem to work on. And again, you can go through this process with someone. And to make it as easy as possible for you, we have a little problem solving worksheet that will just help you give some thought to, the name of a particular problem. And all of this can help with what's called distancing. So you start to see your problem as something kind of outside you that you can get some objectivity about. And we know that can be helpful in tampering down the stress response. Think about what makes it a problem. Why is this a problem to you precisely? how will you know if things are getting better? So what will you know if this source of stress or problem is getting less over time? Brainstorm and think about who could help you with the problem and what it is you might want from them, and maybe when you might talk to them about it. And then brainstorm all the other things that might help in addition to talking with someone about the issue. And then think about and decide what it is you're actually going to do about this particular issue or source of stress. Then, of course, take action and reflect, did the action you took have an impact on the problem or the source of stress? And then think about what's next. And again, this is another worksheet you can do with someone if you choose. And this is a process you can continue on a weekly, monthly or daily basis to help you get better and better at problem solving. So here are some top tips for anxiety management. If the anxiety results from genuine danger and threat, then it may be best to escape. If perhaps you're not really in danger, but you're just experiencing more anxiety than you want, you may wish to consider some relaxation techniques, because when you calm the body, so too the mind can be calmed. Structured problem solving, such as we've just explored. Learning to reframe and think differently about your situation, and also gain some clarity on what really matters, your values, because sometimes you are getting things out of perspective. And when you clarify what really matters to you, your values, that can also help you change your perspective on a particular event or situation. It can be helpful to allow and accept unwanted feelings rather than trying to push them away or block them out. Bringing yourself back to the here and now can be very helpful as well, because the mind's a bit of a time traveller. And when the mind wanders to the future, that can be associated with some anxiety and dread. And when the mind wanders to the past and replays things, that can be associated sometimes with some anger or guilt or shame or regret. And so developing the skill of bringing yourself back to the here and now can also be quite helpful. There's changing the nature of your thoughts, the content of your thoughts, but there's also changing your relationship with your thoughts and getting some distance from them, and seeing thoughts as things that come and go. That can be profoundly helpful too. If part of your stress is having feelings of overwhelm and just doing too much, a range of things you might consider is making more or better use of lists, because our short-term memory only has a limited capacity, and it's often better to get it out of our head and onto paper. It's almost like freeing up RAM in a computer. It can be helpful to write things down in lists, and of course delegating if you can, and saying no, and even postponing or asking for a postponement on a particular piece of work can help reduce feelings of overwhelm. Talking with someone, perhaps even a professional, can be very helpful if your anxiety is too much. And there's also developing self-compassion, because often we treat ourselves very differently from the way we would treat other people, and we talk to ourselves very differently from the way we would talk to other people, and we have a harsh inner critic. And cultivating non-judgment and warmth for ourselves is associated with a wide range of benefits. In terms of books that may help you, this is an excellent book, Mind Over Mood by Dennis Greenberger and Christine Podesky, containing a wide range of cognitive behavioural and thinking skills approaches to reducing stress, anxiety and other unwanted emotions. In terms of allowing yourself to experience unwanted feelings and acceptance and bringing yourself back to the here and now, and the approach of diffusion or distancing from your thoughts, the Illustrated Happiness Trap by Russ Harris is a great little workbook with very clear pictures and messages about how to get better at some of those psychological skills. If you're feeling overwhelmed, then I'd recommend Getting Things Done by David Allen, which has a range of techniques and strategies for reducing feelings of just overwhelm and having too much to do and not being very productive. And in terms of cultivating self-compassion, then the Kindness Workbook and the Compassionate Mind Workbook nice resources you may want to have a look at, with some nice exercises and explanations as to why you may wish to and how to go about cultivating your compassionate mind. Now, if you'd like to develop your own personal stress reduction plan, we have a worksheet for you in which you can think about, based on what we've talked about and what you know already, how you may reduce your exposure to unwanted events or situations, how you might go about reframing or taking a different perspective on some of the things that you're experiencing. Once an emotion has arisen, how might you cope with it, the emotion-focused coping we talked about. What you might do to get better at problem solving or problem-focused coping, and then things you might do to develop what we've called your buffers, or these protective factors in your life that can reduce the impact of stressors on your well-being, quality of life and performance. And again, you could potentially go through this worksheet with someone. So in summary, stress and anxiety are normal responses to threat. It's only if they're too intense or prolonged that they tend to be harmful, and steps you might take to better manage stress and anxiety can include talking with someone, reducing your exposure to some stressful events and even some stressful or toxic people, maybe learn to change the way you think about things, get better at problem solving, get better at managing and even accepting unwanted and difficult feelings, and of course, keep going. And to help you keep going, indeed perhaps to help you get started, you can download a 4-week wellbeing plan in which you may start to schedule certain things you're going to do to manage your stress and improve your well-being. And then once you've decided and put into this wellbeing plan some of the things you're going to do, you could of course put them in your phone diary to act as a prompt or reminder to get these things done.